Hello, Dr. James Bogesh, expert in health and longevity, and today's video we're going to talk about bone health, bone density, and first of all, bone is critically important for overall health. It plays a big role in your risk of diabetes, and obviously we make our red blood cells and our immune cells out of bone, so it plays a lot of roles other than something to attach muscles to and something to keep us upright and our risk of fracture. But most people's interaction with bone density comes from bone density testing, which quite frankly we check way too late when it's more crisis stage rather than our 20s or 30s. We have a peripheral bone density unit, checks the wrist, forearm, and I've seen more than enough patients in their 20s and 30s who are not on a good trajectory. Changing it at that point is much easier than changing it when you're 60. But in general, people don't care about their bone density. They just don't want to have a fracture. It's the same thing like cholesterol. Nobody cares what their cholesterol is. They just don't want to have a heart attack or stroke. And so bone density is much the same thing. However, there's a couple things to consider, and this is going to be surprising to a lot of people because the way things work is we check our bone density. If it's low or scary low, we recommend meds, right? That's the answer for that. However, first and foremost, the FRAX tool, FRAX, came into play, 10, 15 years ago as a fracture prediction risk or tool. Keep in mind that 25% of our bone density, or 25% of your risk of fracture, is bone density. The larger chunk has nothing to do with bone density. It has everything to do with things like risk of falls. And risk of falls has everything to do with ability and muscle strength and balance. So, first off, genetics play little role in bone density. So just because mom or dad had weak bones does not necessarily mean that mom or that you or your siblings are going to have low bone density. We've seen that from twin studies, and so just keep that in mind. The problem with bone density testing, and we've had one in our office for 10 or 15 years, so I'm very familiar with this, and we do routine testing in our office. But those DEXA scores can be about 20% off one way or the other. It's a pretty wide range, and especially if that's what we're relying all of our diagnostic and our direction that we take on. As I mentioned, when somebody has low bone density, the typical medical answer is drugs. However, when you look hard at the data, there's very little absolute risk reduction from meds. So you take Fosamax, you take Forteo, you take any of the new wrinkle inhibitors, and they really don't change your risk of fracture very much. And if you look at fractures of the wrist and the hip, so spine, wrist, hip, those are our principal areas of fracture. It almost has a 0% reduction in wrist and hip fractures. So we think that that's the answer, and yet the answer that we're giving, the only answer we're giving, has a pretty poor outcome in lowering our risk of fracture. So what does? And generally we talk about risk. So you look at the FRAX score, you look at the bone density score, and rarely do we talk about exercise and strength training. When patients come to me, that's the first conversation we're having. I had a consult a couple months or so ago about a patient with bone density, and the first question I asked is, are you exercising? And of course the answer was no. So it doesn't matter what else we do. If she's not exercising, that needs to change. So another interesting thing is hip protectors. Such a basic thing of putting pads on the hips. Think of it like spandex pants with some hips. Those have some pretty good research on preventing hip fractures. Not preventing falls, but if somebody falls, it prevents hip fractures. I think that's a pretty basic thing if somebody's at high risk and they have poor balance. The one of the most important things is to lower your risk of falls. That means leg strength. That means Tai Chi, yoga. The stronger your legs are, the less likely you are to fall. And obviously Tai Chi and yoga and even whole body vibration can lower your risk of falls. So the two things that are most important is increasing bone density with weight training. Generally, aerobic is not going to be enough. We need to do some weight training, whether that's squats, leg press, anything like that, to build bone density. Our office, within the past 9 months, I think we've offered a whole body EMS, which is specifically designed to build muscle and bone as a result. It's funny from a marketing standpoint, people don't care about building muscle and bone, even though critically, like, nothing is more important. And so lowering your risk of falls and building bone density is really the answer to somebody who has concerns, or let me put it this way, those are the only strong answers to lowering your risk of fracture. The medications change that trajectory very little, and they have their side effects. We need to lower the risk of falls and build bone density through exercise, specifically resistance or muscle building exercise. A lot of research and data went into this post, but there was one that's particularly interesting, looking at how we've labeled osteopenia and osteoporosis over the years. I'll include a link to that one in the description, but make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.